Sexual health is so important because it's all about how we look after ourselves and look after each other. Sex should be safe, consensual, harm-free and fun. Unfortunately, not all young people have had the opportunity to receive good relationships and sex education that empowers them to take responsibility for their own sexual health, knowing about the risks from STIs, how to negotiate consent and avoid unwanted pregnancy. So as new students, you'll be navigating through lots of change at the moment. Maybe you've moved far away from home, or this might be the longest that you've been away from home and away from the support networks that you've relied on in the past. That can be really daunting, but also uni can be really exciting as you make new relationships, meet new people, have new experiences, and it's a great time to think about sexual health.
People often think that it can be embarrassing to talk about condoms and contraception and STI testing, but that isn't the case. It's super important to have these conversations, and there's no way you won't benefit from them as well.
A recent study has found that only 34% of students always use a condom when having sex. Drinking can definitely be a factor when it comes to making these decisions. If you are drunk, you cannot consent, and you can also take much more risk-taking behaviours. So please keep this in mind if you're going out for a drink.
The most important thing to remember is that it is absolutely okay to be the one to take control of your sexual health. You are allowed to be the one that suggests having condoms. You are allowed to be the one that says, I want to take things slowly, I want to be safe, and that is absolutely okay.
There are lots of different forms of contraception that you can get access to. These could be barrier methods, such as condoms and female condoms. It could be hormonal contraception, such as the implant or the hormonal coil. And you can have non-hormonal contraception, such as the copper coil. There are lots and lots of contraception you can choose from. You can go to our website at brook.org.uk where there is a long list and all the details about them.
Contraceptive methods will differ within the LGBTQ+ community, where there is a lack of risk of pregnancy, for example between two penis owners or two vulva owners. However, STI transmission is always a risk, so barrier methods should always be in place. And for those who have sex with penis owners, especially penis owners who have sex with penis owners, there is PrEP available on the NHS now.
You can get contraception from your local sexual health clinics, from your GPs or your local Brook clinic. Please do get access to find out where they are in your area.
Condoms will be available within university and at your local sexual health services as well.
One of the biggest misconceptions that we hear about at Brook is that pulling out is a good form of contraception. No matter how strong your pull-out game is, unfortunately, you would have actually produced pre-ejaculation, also known as pre-cum. There is enough sperm in this pre-ejaculation to get somebody pregnant and, of course, spread STIs.
Chlamydia and gonorrhea are two of the most common sexually transmitted infections. Other common STIs include syphilis, HIV, herpes, and genital warts, which is caused by the human papillomavirus.
So all these present in various different ways. However, for people with penises and people with vaginas, all of these symptoms are worth getting checked out. So for example, if you have unusual discharge, for example, if it's foul smelling or if it's a different colour to usual, if you have painful urination, if you have painful or painless sores in your genital area, or if you have itching in your genital area. And also, if you've had unprotected sex and think you may be at high risk, it's worth getting tested.
Some STIs may have no signs or symptoms. And we know that people between the ages of 16 and 25 make up the highest proportion of new sexually transmitted infection diagnoses. Which means if you're in that age and you're having sex, getting tested regularly is a really effective way to protect yourself and other people.
So for example, between 50 and 70% of chlamydia cases are asymptomatic. A long-term implication of an STI like gonorrhea or chlamydia could be something like infertility. Many HIV cases are also asymptomatic as well. So this is why it's important you get tested, because it means you can start effective treatment, and it also means you can start effective treatment early. It also means people who may be at high risk can also be identified as well. Certain groups are at high risk of contracting STIs like HIV, such as men who have sex with men. However, there is now extremely effective therapy, and there's also something called PrEP, which is a pill you can take to prevent your risk of contracting HIV.
While we see higher rates of diagnosis in some groups compared to others, it's important to be clear that sexually transmitted infections do not discriminate, and that if you are having unprotected sex, you are at risk of catching an STI, which is why, if you're having sex, it's so important to get tested.
It is important to get tested roughly every 6 months, particularly if you're sexually active, or if you have any of the symptoms I described earlier. It also allows other sexual partners you have to be identified who may be at high risk of contracting an STI.
There's no need to feel nervous if you've never taken an STI test before. The staff at your local sexual health service or clinic are knowledgeable, helpful and friendly and will help guide you through the whole process. There's nothing to be afraid of, and if you do get a positive result, the staff will make sure you receive the treatment you need to make sure that you can live the life that you want.
The tests for STIs might include a quick blood test, urinating into a pot, a swab of the vagina, mouth or anus. These tests are all very quick and non-painful.
To get free STI testing, you can go to specialised sexual health services and clinics like those run by Brook. You can go to NHS walk-in centres, to your own GP or doctor, or many pharmacies. In fact, many services provide home testing kits that you can order online to be delivered to your own home or another address of your choosing.
It is important to know that all STIs can be treated and or cured. So for example, chlamydia and gonorrhea are treated by just a short course of antibiotics, and HIV therapy is now so effective you can have a normal life expectancy and also be unable to pass on the virus. This is known as undetectable equals untransmissible.
Sexual health services vary depending on where you're studying, but many areas will have a range of services, such as NHS-led sexual health clinics, where you can access sexual health screens, emergency contraception, pregnancy testing, clinic appointments, and much, much more. Your area may also have some more specialised and focused services, such as LGBTQ+ clinics, and much more.
To find out about services available to you, you can look on the Brook website or the NHS website.
Sexpression UK is a charity that empowers young people to make informed decisions about sex and relationships.
Since forming in 2000, Sexpression members from over 30 university branches have been delivering sessions to 11 to 18-year-olds in schools and community groups, providing informative, open and engaging sessions which cover the relationships, sex and health education curriculum. If you're interested in volunteering with us, first check your own university. They may have a branch which you can get involved with. If not, feel free to get in contact with our branch's director and we could support you in opening your very new Sexpression branch at your own university.
Brook is a sexual health organisation, and our vision is that young people's lives are free from inequality, rich with opportunity and enriched by happy, healthy relationships.
In 1964, Helen Brook created a pioneering service for young women who couldn't access contraception anywhere else and desperately needed support. She refused to let stigma stand in the way of what was needed for these young women despite fierce opposition. Over 55 years later, and Brook is at the forefront of providing sexual health services for young people of all identities and backgrounds all across the UK. We support, educate and empower young people to make the best choices for their sexual health and well-being for themselves. We're non-judgmental. We're not here to tell you what to do or that what you're doing is right or wrong, but to give you facts, advice and information to make your mind up for yourself. We're confidential because we understand how important privacy is when it comes to matters regarding sex, sexual health and relationships. And we try and be as friendly and down to earth as possible to make it easy for people to get support from us.
Starting university may feel daunting, but sexual health doesn't have to be. Taking control of your sexual health is different for everyone, whether that be exploring relationships, your body, your sexuality, contraceptive options and services around you. It's important to remember that we're all unique and only you know what's right for you.
So from me and everyone at Brook, I just want to wish you all the best as you start this new and exciting journey into your university education. Please remember to look after yourself, look out for each other, stay safe and be kind. And no matter what you're going through, remember that you are not alone. So reach out because there are people out there who want to help you.